And do we have a motion to accept the minutes of the last meeting?
So moved.
Second.
So moved. And on the first order is going to be discussion of the mask mandate.
Were the minutes accepted?
Yes. And we welcome everybody here as a public meeting and concerned fellow citizens in Waltham. We want this meeting is for us to really discuss. We had an open meeting on September 15th, and everyone was given time to express themselves on positive or negative against the mask. There's passions, obviously, on both sides. We all recognize that. And what we want tonight is just, we have a lot of other business to do, so we just want a very orderly meeting. We've heard from the public. We've gotten 700 plus emails, and now there's some updated data, and we're going to just vote on this tonight. So we hope everybody, listens and understands and accepts. Now, one thing, if anybody wants to video or record this, we already are recording this, for the public TV. But if anybody wants to, they can come. They need to identify themselves. And just so we know, none of the devices will interfere with each other. And let's proceed and hope this will be a quiet meeting. All right, I'm going to open the discussion. Does anybody want to open the discussion on the mask mandate?
I will, if you like.
Yeah.
So I wrote up a couple pages I gave to the members here. Tom, did you get one of my?
No.
So I just wrote a few things down, so just be more orderly. So I would propose for a mask mandate, and this is up for discussion and editing, of course, for people 5 and above, exceptions for restaurants and bars while people are at their tables or actively eating, also exemptions for gyms, yoga studios, exercise facilities, as long as they try to obey the rules of social distancing. And I suggested we do it until December 1st, reconsider then whether we want to let it expire or extend it. And my reasoning is, our job as Board of Health members is to protect the health in any way we can, and a mask mandate does provide extra protection, as most of us feel. Some don't, but most of us do. I'll say we are not an island. All our surrounding communities have mask mandates. It makes more sense for it to be a regional approach. Having one town that's one way and other towns different isn't really appropriate or effective. The towns that have mask mandates near us are Watertown, Newton, Lexington, Boston, Arlington, Bedford, Brookline, and Somerville. And I also said we should be proactive. There is a small increase in the positivity rate right now, not a big one, but a small one. And I feel if we do this, we'll keep it from getting out of control. It's better to do it now than have it get out of control and try to bring it back in afterwards. Another concern we had amongst us was how to enforce it. So we don't have enforcement abilities within the board. It would be up to the police to enforce it. I don't think that's going to be a huge problem. We had a mask mandate last year. There were very few citations. I don't believe there were any arrests. Most people obey the law. Most people, even if they don't agree with the law, will obey the law. So I don't think we're going to have much issue with enforcement. So, okay. If it were, I'm just saying, again, there's no public, discussion. So this is just for the board to discuss amongst ourselves.
You came 2 weeks ago. Well, I'm afraid that's something for the next election, and I
just sent over 2,000 Afghan refugees here to Massachusetts.
Not a public meeting.
Okay, I'm going to stop right here. Just one moment. We're not going to have a discussion. We can't. We've moved beyond that, and I certainly hear you, and I understand. And it is unfair, but as citizens, we have to do what's best for ourselves.
We can decide what's best for ourselves. That's what you
Well, no one's,
Don't argue.
okay,
Festival over the weekend. Trust me, I saw it yeah,
all right.
because it
All right.
funds the city.
And it,
You know, would it be really helpful if you'd sit down and listen to us, because we've just begun our discussion?
I asked him to leave.
All right,
has
thank
to be
you.
removed.
It's helpful if you listen to us.
We did
We
listen to
did.
you 2 weeks ago. Yes, we did. You were here.
Okay, do any of the other board members want to comment on what I said or discuss what I
Yeah,
said?
would like
so
to
we're gonna move on with our meeting.
Yeah.
Go ahead, Barney, if you'd like to speak.
Susan, did you have anything you wanted to add to
I
that?
do.
All right, go ahead, Sue.
I have, after a great deal of soul searching at the present time, I cannot in good faith support a mask mandate for the residents of Waltham. I feel each resident in the city of Waltham should be able to make their choice if they so desire. If you are comfortable, please. Very hard decision, so please, be respectful. The businesses in Waltham have been through enough, and they should not go through this hardship again. I will continue to monitor the COVID numbers, and if the numbers change, I would support a board review at a later date. Thank you.
All right. And Bernie?
Okay, I have very similar feelings to Mrs. Panadosi, and that I believe that the issue...
Could you speak a little louder to the microphone, please?
Is that better?
Thank you so much.
Okay. I believe that the issue of masks is an individual's responsibility. It is not the government's responsibility in all circumstances. Yes, it is our responsibility to look out for the health and safety of the citizens of Waltham, but we have to do it in a responsible manner, and one size fits all type of solution I don't believe is correct, and I've really considered this very seriously, very carefully. I believe that the best thing that we can do as a board is recommend that individuals wear the mask when they go into situations where they cannot social distance or where there is a large crowd, etc. But the exceptions of going into a restaurant and taking it off and then having to put it on to walk out the door, it doesn't make any sense to me. I feel that instead it should be an individual choice. If a person wants to wear the mask, certainly go to. I went into the supermarket today, and there was a lot of people wearing them, a lot of people were not wearing them. And again, it was a matter of choice. It was an individual person's choice. I think the best thing that we can do is strongly recommend that people get the vaccine and that people go ahead and wear the mask wherever they are comfortable. But I don't think that, and I cannot support at this time, based on the numbers, making a decision to mandate something that one size fits all, and I don't think this is the best thing to do.
Thank you, Dr. Marola. So I've based most of my thoughts around the statistics that we get every week. So while there's been a small uptick, 0.02 of a percentage point, there's also been an update in the vaccination rate. So that sort of balances out in my mind. I think the return to school, not only Waltham Public Schools, but the two universities in the city, going to have some impact on that. So at this time, based on that, I also don't support a mask mandate at this time.
Very good. All right. There is really no easy decision with this. If you look at Waltham's vaccination rate, it went from 63% to 64%. There's a large number of people that are not vaccinated. I'm a practicing internist for 32 years, born in Waltham, and practice in Waltham. I was at Newton Wellesley today. The emergency room is seeing an uptick on unvaccinated people, young unvaccinated people. Many of the young ones are being hospitalized. The older people and people who've been vaccinated who are getting a rerun of the virus are mostly going home. So the nature of this virus is it has been programmed to attach to your lungs. It's programmed for that. And that's why it's not going away. And every time it comes back around, it's going to hit you in the lungs. Now, if you have previous antibodies, either from a vaccine or a previous exposure, you're in good shape. Even one vaccine has been proven to be very helpful. Looking at the numbers from the small numbers, we have something like 62,000 people in the population, although this is a very mobile population here. There were, in the last 14 days, and there's two readings here. One was from September 23rd, which is just a couple of days ago, and one was 2 weeks before that. There were 153 new cases in Waltham, and now there are 208. So to some degree, it shows that it is on the rise. One thing you have to consider, and not just what's happening today, but we have to consider what's good for all of us, and nobody wants to take any human rights away. But if studies show that if you've been vaccinated or not vaccinated, you carry the same viral load. If you've been vaccinated, it doesn't bother you very much. 4 or 5 days, you get over it. But you still carry a high viral load, which means, you can pass it around. Now, what frightens me is what's coming down the line. We have almost 2 million people coming into this country. 20% of most of them coming from the southern border are infected with something, mostly with COVID, but there's all kinds of diseases coming in. A lot of children, they're going to be coming into our schools. They did a few years ago, and we're going to get another wave of them coming through. Many people were dropped off without any fanfare or advertisement in Worcester. And I'll give you one question, but we're really not here. Go ahead.
You made mention of vaccinated and unvaccinated, but what about the people who already had COVID and recovered?
They actually, people who've recovered have higher antibodies than it beats out any of the vaccines.
I have not heard the same in the studies I've read, and it wears off quicker from what the studies I've read.
Well,
Yeah.
the long-term studies are out, but when they measured the antibodies
Initially, yeah.
after, and that's why, and you're right, as they
People
as
should
they
still be
wane,
getting vaccinated.
that's why the recommendation is that they still get vaccinated. But I'm worried, you have to think of, I have 2 children in the school system here, and I worry about everybody's children. We don't want them to miss another year. We don't want the school system closed down. I have the Center for Disease, not the CDC, the Environmental Protection Agency you can go to the website, they run down on every kind of mask, and basically if you have the aluminum bar and the surgical mask and it's tight and around the cheeks and everything, it goes up to 76% protection. And then other types of masks vary, and it really depends. But we didn't see much in the way of influenza this past year, and I truly believe a lot of it had to do with a mask. So if it does something, the real question is, should we try to help and protect the children? Now, the commissioner of the school system in Massachusetts still want a mask mandate. They want to extend it from the beginning of October until the beginning of November. And in that instance, I think I would go along only because I want to see what happens in the next month with all these people who are being dispersed. We are a sanctuary state. We have been in the past, and I'm just afraid we don't know whether that's going to spread. The numbers are going up. The emergency room at Newton Wellesley is crowded, and you can, believe it or not, you can call them yourself, but I don't think it's a big thing. So I would favor just continuing at least until November 1st, another month, and watch what happens in October. It's better to be safe than sorry. It's really hard to catch up once it gets going. And there are too many variants coming out, and there may be more variants. There's a Mu variant from Peru. There's a Lambda variant.
There will be endless variants until the vaccine passport system is installed, mark my word.
Well, all of these things will be ironed out. We have to figure out right now what do we want to do. So do we want to just do a vote at this point? And
I can do that. So the
so you're
motion would be
in
my,
favor?
my proposal. Would people feel more comfortable editing it to November as opposed to December that I did? I'm willing to edit.
I
That
would
would
like
let
to
us
addend
go
it
in
to, just move to
conjunction with the
November.
schools. With
Just
the
another
schools.
month.
Saying a yes vote is to adopt the mask
Adopt the
policy.
mask mandate until November.
Okay, and a
with
no
the
vote is not.
Exemptions for eating restaurants and gyms if they do their best effort to do the,
Yeah, I don't think that's asking too much.
yeah. So, okay, so I'll make the motion then, amend the paper I wrote to November 1st from December 1st.
Do I hear a second?
Second.
All right, the motion is passed.
I think we should we vote individually?
You want to vote?
Yeah, I think we
The
should.
motion is passed to addend
Roll
it.
call vote.
Yeah, I think a roll call vote, so.
So I would be in favor.
No.
What was the motion? I'm sorry.
The motion is to adopt the mask mandate that I wrote up until November 1st. I wrote on the paper December. We would edit it to November.
Starting November 1st?
Starting
ending.
now, I said starting Monday, the 4th of October, and extending until November 1st. So it's a month.
I think we could just revisit it in a month and see what,
Absolutely.
you know, whether we want to even put it in at that time, see how it happens. I don't
Well,
think we
the
need it.
motion was to put it in now for the month,
Okay,
so.
so we're going to vote either yes or no?
Yeah, on that.
Okay,
right.
on that.
And obviously, we can revisit things anytime. Yeah.
So I vote no.
Okay.
Yes.
Yes,
Yes.
No.
yes. So we tied.
So it's 3 to 2?
3 to 2.
3 to 2.
3 to 2.
So the motion is passed.
Yes.
All right.
Taking a vacation, no.
Hey, hold on a second. You're talking about taking Afghan refugees that don't have to be vaccinated. We don't know their status. And you expect Americans to cover their face? Are you kidding?
You know, we can't have this, I'm really sorry.
All right.
We
so
can't
that's-
have this.
What's our next
We're
on
not
the
against,
agenda?
hey,
We've had other stuff on where stars are not masked, but every person around them's masked. This is a caucus here.
I think we should get the.
try to,
You guys don't have the right to do this.
Yeah, they're not really helpful, are they?
all right, this isn't,
Okay,
it's
so
not
what's
open
next-
for
Next on our
discussion.
agenda,
All right, let's move on. All right, this discussion it's closed.
Next item on the agenda.
The letter from the mayor.
Okay.
All right, we can't have any more interruptions. We're going to move on with our agenda. We voted on it.
Did everybody read the letter? Did you read the letter?
yes, I did read the letter.
All right,
I'm gonna sit down and be quiet at this. 28 days is
Gotta
the
ask
cycle
them.
of a move. No, it is not gonna make a difference. And you know,
Officer,
the city ordinance is not-
you're going to have to be removed. I'm sorry.
Regardless of the self-report, this is about making us do something we want to do as citizens.
Nobody's going to make you do anything. You don't have to wear the mask. We're making, the mandate is there. It's not, there's nothing, nobody's going to enforce it. Nobody's going to put you in jail.
No merit to it whatsoever.
The end of discussion. We're going to move on with our agenda. We got too many things to do. Any more interruptions, we're going to have to ask you to leave the room. I'm sorry. All right, what's next on the agenda here? We're going to,
Mayor's letter.
Here's the letter right there.
Mayor's letter?
so we're going to move on to the mayor's letter. Has everybody read the mayor's letter?
Yes.
She may want to speak. Yeah, may want to speak on this coming up.
Is she here?
Yeah, down the front. They're coming up.
Good evening.
Good
How are
evening,
you?
Mayor.
I have a letter from September 15th to the acting commissioner. I believe
Director Michelle Fieldy provided it all to you?
Yes.
So I would just like to update that it'll be 64% vaccinated, and then the current date.
Right.
And I would like to know whether you would like to advocate for having a vaccine location in Waltham where we could try to increase the vaccination rates in Waltham. That's what I would like to send this letter for.
Well, one of the problems, Mayor, is that because it's a state-run program, there has to be some form of medical history, so you know they're not going to have a adverse reaction to the vaccine, and there has to be some form of registration. And I don't think that the state is allowing, and we can consult with the director. She'll be up in a shortly.
I agree with what you're saying, but the problem is that what I have
I
is this.
understand.
If it's a liability issue, I understand that. But that confidentiality for the medical history on the contact tracing is different. And see, if this was a straight medical issue, you go in, your medical information remains confidential. Here, it does not necessarily remain confidential. So I have no problem saying what you're saying, meaning provided medical confidentiality is maintained. And that's the problem. So when they have this big contact tracing, you have to put all this stuff in, but that goes to a study, and then your information does not necessarily remain confidential. So I think that's the missing piece of the vaccinations that they've been doing statewide. I'm not really sure that they'll agree to it, but I do believe that if we have the ability to do it and they say the medical information is confidential, then I believe that we would be achieving both. So maybe you opt in or you opt out as to having your information go to someone other than a medical facility that's subject to HIPAA. So, because that's the very issue that's at play right now.
I understand. Your goal is wonderful. I
Yep.
agree. We just need some record if there's a bad batch of content. We need a record of how to get in touch with them.
Okay, so
Yeah.
what I suggest is that you amend it for those concerns, the letter, and I'll be happy to do that. But I would like to put, providing that medical information remains confidential between the medical professionals subject to HIPAA. Because when you have to go for your vaccine, you have to fill out all those papers. And you have to sign away everything. And I think if we can go back to a doctor's office where there's a patient confidentiality and have that requirement, I agree with what you're saying. I just don't know how else, let's opt out on the contact tracing.
Well, that's an interesting point. I'm actually just thinking, we have 4 or 5 hospitals represented in this city with their clinics, from Mount Auburn, Beth Israel, and Partners, Newton Wellesley, and St. Elizabeth's. And it would be interesting if they could do it through the offices. That's a possibility.
That's even better, because then we know for sure that there's going to be confidentiality.
There is a vaccine bus, I believe, from the state that can be brought out and give vaccines, but because it is a state-funded and program and everything, they are going to require registration. Now, what they do with that information, if they put it in a study or anything, it's supposed to go anonymous, but we know what happens with when they hire.
So what I suggest that I do is talk to the lawyer at the Department of Public Health in the state and express my concerns that I'm trying to get more people vaccinated, but with what is going on, and express your concerns that the medical confidentiality and the medical documentation has to be given, but there has to be some way to do that. So based upon that, I think I can speak to the legal end of it and ask them, is there a way that we can do it that maintains the confidentiality
And
and provides what anybody needs, meaning medical history. So, because someone could get sued if the vaccine does something to someone.
All we need is a name and contact information. We don't need ID or anything like that. We just need a
Okay.
name and contact information.
And all the records are kept by the State Department for vaccines, not, the Health Department doesn't keep any
That's when
records.
people are
Yeah.
concerned, they don't
Yeah.
trust.
And that's why they won't do
Right.
it, so.
Right.
But they do allow us to run local vaccine clinics. I think that the contract that they made with partners for the contact tracing, because when I got my vaccine, the paperwork is terrible. Terrible that you have to sign, including, that it's not even authorized, but it's authorized now. But what I'm getting at is that paperwork was designed to protect the companies, I think. But I do agree 100% with you that it should be a doctor-patient relationship,
Yeah.
or patient-hospital relationship, because there's consequences if you violate HIPAA.
No, I think if they'll allow us to do that, I think that would be great. You just opt out of the contact tracing and know that, if the state were to say, hey, we got a bad batch, they can get in touch with whoever's holding those records and let them get in touch with the individuals.
Yes.
I think that would be wonderful.
And then
could
that
be
would all
worked
be
out.
at a medical facility. I think Dr. Marol is right.
I'm
It
gonna
can
check
be at a
into
medical
medical.
facility.
Right.
Okay. As opposed to local. We
Right.
bring the medical facility out here,
That's
or they
right.
go
Right.
there, okay.
So what volume of people are we talking? What?
Well, we have, it's 64% right now, I think,
So a
based
third,
on the last data for September 23rd.
20,000, of course.
Yeah,
not
so it's up
everyone's
to,
gonna get it.
fully
So-
vaccinated resident per capita is 64%.
So the goal, a few thousand people would be
Yeah.
great if that happened, yeah.
And several people have said to me, the reason why they can't get it, they don't mind getting it, but they can't choose between their children and the vaccine. So we're like a city, and a lot of people that we have, we're an urban environment, and I think that's one of the reasons why we're not getting the same vaccination rate.
And I think, Mayor, I don't know if it applies for this letter, but one issue to address probably with the state in this regard is the state requirement to be in the state's immunization database, which I don't know how that would relate into this, but I'm guessing they're gonna ask for the minimum required information to apply those vaccinated into that database, so
Yeah.
that might be a hurdle.
Well,
We can volunteer to give the state a number so they can, brag about the number, but not the names. That in this particular program, we vaccinated 500 people or whatever, so
Right.
we can tell the state. So when
And I
they
think the
tally
issue
their-
from the state's point of view is,
Yeah.
if I'm vaccinated in your office and I go to another doctor's office, that doctor can access that immunization record, so.
that's another doctor, though, Mr.
Right,
Hamlin.
another doctor, right.
Can they?
It's
Dr.
non-doctors
Marola,
that
can
I'm
you
worried
access
about.
that? If someone comes to you for a vaccine?
I'm going to find out, because I'm going to be
I know, I
in
mean,
contact this week.
I'm not a
with-
doctor that would give vaccines, but I know I have no access to that.
Well, they haven't brought it out, because of the
Yeah.
refrigeration and everything required and all of that.
Right.
But as I said, there are many hospitals that are represented in Waltham, and they take care of Waltham patients. And it would be an access for them to gain new patients as well. And there's many other diseases besides COVID that need to be looked at. So I think I'm going to look into it and see if we can coordinate something and maybe have a vaccine day and advertise it.
Okay.
And I'm sure that would boost us up at least a little bit more, maybe over 70.
And
or more.
I'll do the legal route, through the law department and contact the Board of Health's, State Board of Health's lawyer,
Thank you.
to discuss why we would like to do this and what we hope to achieve. Okay?
right,
So
thank you.
I'll get
Question
back
about the
go ahead.
children, I don't think the state's gonna have an answer for that.
They don't have it at
Yeah,
this time,
yeah.
and Pfizer is,
We're following
Yeah.
the news, you're
So-
following the news, so you know, yeah.
yeah, so I'll leave that part out,
Yeah.
okay.
Yep.
I hear you.
Mayor McCarthy, are
Sure.
you going to be notified of any refugees coming to Waltham or going into our school system?
I haven't been notified at this point.
Do you think, I mean, it would be appropriate that you would be, but from what we've seen on the news sometimes,
I can inquire into the
Inquire into
superintendent
the
whether or
state
not
and
he's been
see,
contacted. But as mayor, I have not been contacted.
they've brought people into Worcester already, and we need to be a little bit prepared for that, I think.
And I think there should be a requirement, for schools, you have to be vaccinated, so. So if they're going to be
But
enrolled
they're
in the
not
school.
vaccinating these children, and they're not
Well,
vaccinating, and they're not
then
requiring
There's a
it.
problem then.
No, there's not a vaccination requirement at the schools.
But you have to get your
Well,
MMR.
Not
Oh, no, I'm not talking
MMR,
COVID
I didn't
vaccine.
say this vaccine.
Other vaccines,
No.
yes. Correct.
In order to enter school, you have to have your
My brain's on
MMR,
COVID, yeah,
measles,
okay.
mumps, and
Sorry.
rubella.
But to come into the country, and there's
Yeah.
a lot of children.
Okay, all right, I'll inquire of the superintendent, if you like. Okay, I thank you, and I just ask you to please table that till I can come back. I hope that I can get some positive answers on trying to increase the vaccination rate in Waltham.
Thank you.
Okay? Thank you very much.
Thank you.
Back to the first issue. I'm just confused. I'm fairly neutral on this anyway, but I'm still confused.
We're in a regular meeting.
What?
We're in our regular board meeting, sir. I'm sorry, you can't speak here.
I know, but we
Right now.
sat here and it didn't make sense, that's all.
Can I speak to you after the meeting, when we finish our meeting today? Because it's not dedicated. I understand your passion. I'm happy to listen to you until 9 o'clock
It's
tonight.
confusion. You talked about the mandate, and then 3 people made their recommendation out of 5 of you. 1, 2, 3 were all no's. You switched gears to a mandate in the schools, and then it all went
Well, it is a
weird, and then you had a
mandate.
vote, and somehow you got the votes on the yes when someone just said they would vote no against the mandate. So it doesn't make sense. I'm just wondering if everyone knew what they were voting on, because it sounded like you were talking about the schools.
When we amended the vote, Susan thought that was reasonable, and she voted yes, and that's what made the deciding vote.
Okay, all right, no, thank you. It was confusing, and thank you for clarifying.
You're welcome. All right. Next on the agenda is Sanofi.
No, Modalis, we're going out of order because Modalis showed up first, Mr. Chairman, so Tommy's getting Modalis now.
Dallas.
Mr. Chairman,
I'm sorry?
Mr. Chairman, we have Ed as well. Ed's going to talk about the DNA companies as they come up, so the board can approve them and understand what they're doing, so. But the first one is
Thank you, Ed.
Modalis.
So should I have Ed talk first, then, when they come in? Is Ed going to talk first?
Ed can talk first, yes.
All right. Ed, if you want to come up and you want to introduce the facts to the,
Yep, yes, Ed, please.
So this first company is called Modalis. They've been in Cambridge for the past 5 years doing similar research. And as you know, Cambridge has a very thorough and extensive biosafety committee and biosafety regulations, and they've been approved there and doing the same work. And they're moving to Waltham to scale up some of their research. So they use CRISPR-Cas9 gene editing technologies to cure various inherited genetic diseases. So they're moving to 43 Foundry Street. Their facility control all looks good. Their floor layouts and safety procedures all look good. Nothing in their recombinant DNA research looks risky. They use standard cell lines and standard viral vectors to transfect cells, so that all looks good. Their safety procedures, lab policies all look pretty standard, so I don't have any concerns with their application and would recommend to approve.
Thank you, Ed. Any discussion?
They gonna make a presentation or what?
They did downstairs in
I
the
know,
bio
to
safety.
us.
I don't think it's
No, I don't
necessary
think so,
to
because
make another
we were
presentation.
there.
Ed is
They talked
our
about
interpreter
it.
with the,
Okay, then I have a couple of questions
Okay.
of them. One of the things that I believe we require is a copy, an electronic copy of your floor plans, your chemical inventory, and your safety manual. Okay. I have received the chemical, but I have not seen the floor plans or the safety plans, and this is forwarded to our local emergency planning committee so that in the event of an accident or something going wrong, the fire department and other first responders would readily have that information available. So that is actually one of the requirements for your licenses, that we do receive that. Did we get that electronically?
We did.
Okay, because I didn't.
I didn't email you everything. It was coming in, everybody sent in bits and pieces at a time, so.
Okay.
I do have it.
So we do have that complete?
I have all of them right here on everybody, so
Okay.
yes, I have it.
All righty, that's fine.
any other questions or discussion?
Is there, sorry, Dr. Wall, is there the standard cleanup contractor and all that we've seen before, all that?
Yes.
in place?
So they're all listed here. Yep. Stericycle, Veolia, yep, same
Thank you.
same
Okay.
crew.
Okay. Do I hear a motion to approve?
Motion to approve?
Second.
Motion is passed.
Yep.
And we will move on to,
Yep, so the second one, I will get the second one.
Yeah.
So what that means, Modalis, is your permit is approved. I will get that to you within the next day or two, because I didn't have time, and I am short-staffed. I do not have a clerical, so I will get that to you. But again, congratulations, welcome to Waltham, and I will get that to you, okay? Thank you very much.
I had asked Michelle for that Saturday. She said it was gonna be in our packets. In our packets. That's why I asked that question.
all right, and you can,
Yeah.
you may want to, I don't know if you want to ask.
No, I don't think so.
Other people, but it
I'll use Michelle. Yeah,
should probably his.
the next, I think she just overwhelmed, to tell you the truth, but I just, that's the only reason, because we required that, and, it's just that we hold up the license. Prove it, but not absolutely true, until they provided that documentation, that's all. Okay. I do have one for this next translate. There was a question about what they had on their chemical inventory.
Ready?
All right, yes, Ed, please.
Okay, the second company is Translate Bio, which is now part of the Sanofi family of companies that was just acquired a few weeks ago. They're moving into 200 West Street, which is a new facility, new building going up. They have a mRNA technology encapsulated in lipid nanoparticles, which is very similar to the vaccine, some of the vaccines that are being distributed now for COVID-19, but it's a more general capability to be able to treat a number of both therapeutic applications and vaccine applications. So they reviewed with us their environmental health and safety programs. They're also their institutional biosafety committee, all their permits and registrations, like you asked for, the floor plan and the chemicals on site, the waste management and the companies that they're hiring. They will eventually have a vivarium, which is an animal facility. That'll be built a little bit later, and so they're going through the regular, what's called the IACUC, which is an animal control process where you bring in people that review how you handle animals. So they'll have mice and rats in that facility, but everything in their processes looks reasonable. The materials that they're developing aren't inherently pathogenic. They, in their pilot scale-up production, have the appropriate secondary containment and berms and response plans. So everything in there looks reasonable. So everything looks safe, and I recommend approving their permit.
Thank you, Ed. Any questions or discussion from the panel?
Yeah, I do.
Go ahead.
One of the things that I received today from the director was your chemical list, and on that email, there was a reference to it being representative of what was in your Lexington facility, if I read it correctly. But it wasn't clear to me whether that's actually what you have on site, or whether this was just, well, this is what we're going to have, or that's what I wasn't clear about. And then I have to give that information to the LEPC. So could you clarify that for me, please?
Sure. The building at 200 West Street is under construction, so there's no activity. The list that I sent out this morning was what we currently have in Lexington. And the operation will essentially be analogous to West Street.
Okay. And you will be notifying us once that that is operational and you have received those chemicals, is that correct? Yeah, I would stipulate that be part of the permit, that as soon as they are functional and, they provide us with an accurate on-site inventory. Okay.
All right.
You are not scheduled to open until November, December, December, so they have time.
Yeah,
They're not-
no, that's fine, as long as we get it. I just want to make sure, because it was a little confusing the way that was written.
Okay.
And when they do move from Lexington, actually, I was going to say they would inventory the chemicals that they're bringing in, but they do have an inventory system, so that will be easy to.
No, we just want to know what you actually physically have on hand at that point, obviously, once you open, okay?
There'll be a period of overlap as a stage move for some of the labs. So some will happen in December, January, February, but we can certainly provide the inventory list at the time of the
Okay. That would be fine.
Any further discussion?
No, I'm good with that.
Do I hear a motion for acceptance, approval?
So moved.
All right, motion is passed.
Perfect.
And thank you, Ed, and we'll move on to.
We have one more.
You have one more.
We have one more. So you're approved, so thank you. Welcome to Waltham. I'll get your permit to you within the next few days, okay? Because we still have time for us three to work together. Want to just grab the other one, just make sure they get out, okay?
So this is another branch of Sanofi that is already working in Waltham at 153 Second Avenue, and they're working under an already approved permit for the research that they're doing on developing manufacturing capability for delivery systems of medicines and genetic payloads. So they're here today to talk about a new facility at 225 Second Avenue where they'll scale up to a larger scale, going from 500 liters to 2,000 liters, but of the same process. So what we really reviewed was their safety procedures for that scale up, since they've already previously discussed with us the inherent biosafety levels of the research that they're doing. So in the scale-up, they went through very helpfully their engineering controls, their administrative controls, and the PPE of the personnel involved, and all the multiple steps to ensure safe production at these larger volumes. So everything looks pretty straightforward. They talked about their hazard response and their waste management, and everything looks reasonable and according to plan. So I don't have any concerns with their application to scale up the process, what they're working on now. So recommend to approve.
Excellent. Thank you, Ed. Any questions or discussion?
Would anyone be working by themselves with that kind of volume? Nights, weekends, anything like that?
Our administrative controls and our procedures and training are supposed to be done one person by himself.
What's this company called?
Sanofi.
All right.
So this is what you already have an operation at 225, that's correct, that we've permitted, or is this a whole new thing? It's a little bit confusing.
You're at 153, right? That's what the
You're at
permit's for, 153, and 225 is a new building.
It's a new building, so
Yes.
therefore we have a whole new,
Oops, sorry, go ahead.
Sorry, if I could just say that we do have an existing permit at 225. It's for BL1 and BL2 work.
okay.
At labs, so what we're looking to do here today is increase it to a pilot scale.
Okay, and we've also increased the amount of chemicals and what have you that are being stored there because of that? And
So Simon Lewis, you might be able to speak to that. I don't see a giant increase in the chemical inventory.
Yeah, it's more medias and cell culture, so it's more the biological component, not the chemical.
okay, so what we currently have on file then is pretty well representative of what you have, is that correct?
Yes.
That's
All right. Do I hear a motion to approve?
Motion to approve.
Second.
All right, motion approved. Thank you so much, Ed. And
Thank you.
Thank you.
Yeah, good luck.
Do we have representatives from Blue Moon? Blue Moon?
How you guys doing today?
How are you?
We're here to dispute a ticket that was given to us on June 25th. We weren't given any information over the ticket. We were told that we sold to a minor at 3:30 p.m. We weren't told what we sold. We weren't even given a correct address at first. A lot of the information that was told to us at the date of the issue of the ticket was incorrect to our store. For instance, they mentioned there was a female working at the store. We do not have any females on our staff. And we'd like to dispute that this actually happened.
Do we have the details?
Mike, can you speak to him? Yes. State?
Yep, he's here.
Yep. So just so I can set the stage, I'm sorry. The state did this thing on the smoking establishment. We only did the ticket part, so they'll be the one that speaks on it, okay? Thank you.
All right. If you could have a seat a moment while he explains. Thank you.
First off, I apologize if I'm a little bit sniffly today. I actually had my nose cauterized on the way here, so acting up a little bit. But to get to the meat and potatoes here, at roughly 3:30 p.m. on June 25th, I had traveled to Waltham, and my youth that I hire to do our enforcement checks entered the Blue Moon location located at 410 Moody Street. At that time, the female youth went in and spoke to a mid to late 20s male We had done this inspection based off of a complaint that I don't know if it was the board or the office received, stating that there was a concerned citizen whose non-of-age child had purchased tobacco products that were flavored from this particular location and gave us that they were to use the code word, "Can I see the list," in order to see these products. Based on that information, we conducted our inspection. The youth, who I will not name for, security purposes, went into the location and was able to purchase one of these items, which is a Crave Clear. I can pass that around for you if you'd like to see it. It is a disposable vape product. The cashier told her that it has a menthol taste to it, even though it is flavored or listed as being unflavored. She had been trying to purchase either something that was mango or mint to establish if there was flavors. The clerk apologized at that time and said that there were no flavored products, that they had been removed, but to try back in a few weeks and that maybe her luck would improve. But based off of that, the only violation that was found was, of course, the sale to the minor. The minor was 20 years of age at the time. I do have a copy of her ID, as well as her picture here, if you would like to see.
How old was this person who purchased it? How old?
She was 20.
20?
Is that the source of the confusion? The person making the purchase was female?
Was
the
female.
staff wasn't?
That is what I assume. In my report, it does say that it was a male. And at that time, once the product was purchased, I actually came here to the center and gave it to the gentleman on my left. So he has had it since then. With that also being said, the location in Blue Moon Smoke Shop is an adult-only location, so she legally should not have been allowed to enter the store, period, let alone purchase anything. So she was not ID'd at the time of her visit. If so, obviously, you would have seen that it says under 21.
How much was the ticket?
It was $1,000. It was a first
And
offense.
was this the first offense for this facility?
Now, is that fine from the city, or is that fine from the Board of Health? All right. Any other questions?
Does Mike have anything he wants to add? Our Inspector, Mike Delfino. Does he want to add anything?
Do you want to add anything to that, Mike?
No, I think what Mr. Griffin has described is accurate, and what I just did was send out the ticket. Mr. Griffin provided me the information, and I put the cease and desist order together.
No, you're from the state.
Yes.
Let's see. And what is the average initial fine for something like this infraction?
So because of the new state law change that took effect, unfortunately, right in the middle of COVID, it took effect June of last year. The minimum fine for any violation that is of a state regulation is $1,000. So every first offense is $1,000. And then it goes up to $2,000 for a second with a 7-day suspension minimum of their permit. And then for a third is a $5,000 fine and a 30-day suspension.
And that's been in effect since June?
Since June of last year.
So over a year.
June of 20?
June of 20, yes. It was voted on, I believe, November of 2019 and did not take effect until June. So.
It was all in the news then.
And that's essentially levied by the state. It's a law.
Yes.
All right.
Do we have the authority to lower it?
To my knowledge, no.
No?
I don't think so. If it's state law, there's not much we can do.
Seems pretty cut and dried. It doesn't,
Yeah.
All right.
and it seems like, essentially there was once when whoever, notified that their child had purchased it, so that seems like a non-prosecuted offense, and then this was a second one.
How many infringements have let's say this year alone? How many infringements, has the infringements gone down since this law has gone into effect?
With the effect that COVID had on business, a lot of the inspections had been held off. Some of the other communities that I work in, for instance, Bellingham is one of my territories. Our first round of inspections, Bellingham has 30 locations, or 29 now, and they had 17 violations in their first go-around. Those have now since improved, but they've also had several more rounds of inspections.
Well, we appreciate it very much for you coming and explaining to us. And are there any further questions? And we'll bring the Blue Moon back up for...
No, I was just going to say, I think we should give them the opportunity to speak.
Yeah. All right, thank you, sir.
Thank you.
So, for the Blue Moon?
I think the only thing that we'd like is that there be like proof of purchase, like an actual proof that the sale actually happened. What we see is a product that you can pick up anywhere and a photo of a person, and it doesn't really prove anything to us. Basically, you just come in and say it happened and we pay you $1,000. That's the way we look at it.
Before we answer that question, were you aware of that law as you have a tobacco establishment?
Yes, very much so, yes.
And how do you conduct, carding people who come in?
I card people instantly as they come in the door. We don't allow people in the store to linger or look or be around under 21. If somebody comes in the store, they've been ID'd. This was a surprise to me when it came up.
And adding to that, we added 2 more employees to the store to keep it more strict. We have 4 employees now, whereas my store don't do that business. We only need 2 employees, but keeping their law to enforced, we have 4 employees, extra employee cost to us, but we are still bearing to keep the law intact and keep all the kids away from us.
And they're all trained.
We're strictly trying not to do it. We're trying all our best to do it, but if somebody went to the bathroom and somebody walked in for 2 seconds, there's 1 person left and 2 customers, the customer need to understand that one human can attend 2 to 3 customers at a time. If there are 5 customers to go, he will take a time to ask for ID.
The first time I talk to somebody, I'm asking for their IDs.
ID, that's the first thing we do.
You know what I'm saying?
Greet them, hey, how's it going?
I'll break off from customers to ask for IDs when, they needed my attention too, but at the same time, I understand the importance of what we're doing. You know what I mean?
And being important in allowing us to do business in Waltham, which is very important for us. As an opportunity, we don't want to miss that opportunity. It's great for us. We've been doing great. We have employed 4 employees, helping 4 families to survive. And, just giving a picture of Crave, which does not, because you can go to any smoke shops in Boston and Cambridge, in whole Massachusetts, they all have same product. Just having a picture does not prove that we sold it.
Right. Now, what identification do you request when they come in?
State ID.
So
or
that
passport.
would be a driver's license or something?
Driver license, mass ID, or passport. If you're not from country, your country's passport. That's a minimum requirement.
No photos.
No photos, no pictures.
Do you scan the...
No, we physically check it. There is no process of scanning it as of now, yes.
So many establishments have a scanner.
Scanners.
And that scanner can record who the person is.
We can definitely implement that.
And all that. And because of the high liability, I would suggest you look into that.
Definitely.
For the future. In terms of, we'll bring back the state and find out what the ability to come forth with the evidence is. I think to some degree, it's a stiff fine, but there's been growing reasons for restriction in tobacco, and every city has dealt with this, and these are just some of the laws. We all have regulations now that we're not sometimes there are false IDs, but I think if you have a scanner, you have documentary proof, and it would have showed on her card because the scan code is on there.
We'll mandate it in our stores.
And it's not an expensive tool. All right. Now, if they come back and they do have evidence of proof, which they seem to have, you're going to be obligated to pay that.
We'd pay the fine and obviously continue to be tight and run tight as we are, you know what I mean? But if it did happen and we knew pinpoint how it happened, it would help us
to improve our business
exactly.
more better, to control more faster and more eloquently. Like before it even happens, we should control it.
I was working at that time?
I was working at the time. Nobody is making the mistake of me as mid-20s to late 20s either, just saying.
Yeah.
So I'm kind of relieved to find out too. Like I just don't know personally if a mistake was made, if I personally did it myself either, or my coworker at the time was the one, and we need to talk to him instead. It's just the little things it's not just in the matter of proving it, it's in the matter of moving forward and doing better if it did happen.
Right. That's
I
but-
do have a question.
Go ahead, please.
You stated, when you first started speaking about it, that when you are there, you check everyone's ID that comes into
Yes.
the store.
Yes.
So how
I
did
have
this
a
happen?
30 and under. I aim for 30 and under, and I'm shameless of it. You know what I mean?
Well, one thing I don't understand is if we don't have the authority to reduce the fine, how do we have the authority to wipe it out?
Oh, we can't. We can't
So
wipe out.
what's the hearing for?
Well, they wanted to come forth and understand better, I think, what
Okay.
happened.
Because
It
might
was
happen.
either
Can you
that or
come
we
up, Mr. Griffith?
just pay the money and like, wait for
Right,
them.
well, he'll
you know what I
explain.
mean?
Go ahead, please explain.
The state has set the precedent and the minimums for what the fine values must be, but it is up to the individual boards of health. If they do feel that there was an issue with process or something to that effect, that they can basically overturn the ticket. So you cannot reduce the fine from, say 1,000 to 500, but you can say that, the violation did not occur, in which case you can remove the fine in its entirety, because the fine is coming from the city as opposed to from the Commonwealth.
So if they appeal, who would they appeal to?
They would appeal to the board.
To us.
And then, depending
Were
on,
you personally there when this happened?
I was not inside the store, but I was the one that was personally there, yes.
Did you see, like, in the window what was going on, or?
To an extent, there's obviously shelving and things like that that obscure my view, because the register is
Right.
roughly halfway
Could you see
between.
if it was this individual here?
I could not see who the
You cannot
cashier
see,
was,
okay.
but I can say that she was not carded at the door.
Not at the door, because I agree with that, because there's nobody standing at the door. It's a customer service, it's not a restaurant that is gonna be a host to open a door. It's a smoke shop that sells $10 product. We're not selling $1,000 meals. So we can have a host to open a door.
Do you still have the product on hand?
Yeah. As I said, that product is available across Massachusetts. You go to any smoke shop, 21 plus, you will find that product. Any smoke shop.
And you can correct me if I am wrong, I know on cigarettes that there's actually a number stamped on each one that they can track it down to each individual store. When it comes to vaping products where they are a newer product, I don't believe that same technology is there, but there may be a chance we can get a batch number off of it to see, where that shipment went. And that's probably the best I can do. Besides that, I know that, the item cost $10, it was paid for in cash. I didn't receive a receipt because they were not given one, but that's all I have.
Did the purchaser get a receipt?
There was no receipt given to the
No
purchaser.
receipt?
All right. And how long have you been in business for the Moon?
It's gonna be 30 years.
On Moody Street?
On Moody Street, it's gonna be 30 years.
30 years?
30 years.
Oh,
So
30
3
years.
years right now. I never got a ticket violation ever, ever. And we have been always strict about it, always very strict about it, never. And this is like, even if it happened at the same time, a state could have, because it happened to us in Boston store. The state walked in and said, hey, it's your ticket, here you go. You just served somebody underage. That was the first instance, that's 2 years ago, and state walked in straight up and gave us a ticket. So why could have state not done this right now? Why was not ticket given to us immediately? That you don't carry a ticket, you carry a ticket. You can come and give a ticket if a ticket was, if it's sold to underage people. That's only my concern. If it was sold, there should be a proof so that we can be more careful about it. And more than proof, what happened is the incident he explained, and now as you said, we're going to bring that machine first thing you add, just put your card, it's 21 plus, shows up, you're not, you just walk out.
So if there's a first infringement, is that the fine for the first infringement? What's the fine for the second infringement?
$2,000 and a mandatory 7-day suspension.
So they've been functioning well for 3 years. They've never had a problem. They're appealing this. And would it be reasonable if they came back with the proof of the installed
I just have a
machine?
question. Was someone else working with you that day, or was it just you? You don't have that record?
3:30 time, it's him alone. It's a lunchtime, shift change time, lunchtime.
I've seen businesses where somebody does things on their own, sticks the money in their pocket, I don't know who your employees are, but I hope not, too, for your sake. I once had an employee do that.
Please.
Yeah, can we do that? Yeah. Table it until we get that
he wants
batch
to go ahead.
information?
I was going to say, if I may just clarify a
Yeah.
couple things. So 2 years ago, when you received your original fine, was prior to the new fine structure that is now in place. At that time, every violation for tobacco was done on I believe it's the 31D certificates. They're non-criminal tickets with a maximum fine of $300. Now that the sign values have increased to $1,000, it now is in a different section to where they have to become a correction order and a cease and desist order that are given to the store. With the agreement that we have with Waltham, the city generates, obviously, the ticket and cease and desist order upon our findings. We do not issue the tickets on site.
Okay. Well,
And if I may say one,
please.
it is outside of the purview of this meeting, but I have been to that location more than once. I was there back in May, I believe May 31st of this year was actually the first time I went in there. I spoke with the employee named Kevin and kind of went over, this is what we are going to be doing for compliance checks and so on and so forth. And I was also there roughly a month or two after the sale in question, and there was another violation at that time on a different section.
Was it for a tobacco sale?
Not for sale, but for tobacco flavors that are also covered in the sale.
And which we don't sell. So but after he came in May, we made sure that all the flavors, we kept it back. Like we don't have storage units, so we have to keep it in the store because it's a cost to us. And vendor that we bought from before the law passed, they don't take it back. So we put it in back, we seal up and leave it in the back.
So there's been more than one infringement?
No, this is the first incident.
Under this new law? It's the first infringement of 1,000 under this new law, but there were previous infringements in the last 3 years. And were you fined for that?
This is the first fine we got, $1,000.
He wasn't fined for that?
He was fined a second time.
Which is recently you're talking about?
Which is recently.
Yeah, which is recently because they found flavors left over on the back. We were not selling it. It was kept over there unopened because it's a part of inventory. It costed us money. I can't just throw it away. So I left it in the back unopened. Still unopened, you can go and check in the box, which they come and sealed up. Still unopened, the boxes of the flavors are still packed, brand new. You can QR code, you can still find, there's not even a single piece taken out. We were not selling it because it's a part of inventory. For account, we kept it in the bag just so we can come every time we make it, it's a money for us. So that's why we did not throw it away. But it still as an inventory, it's 100% inventory, we never opened it after they told us not to sell flavors. And this, the one he showed, the clear, it's a clear, there's no flavor to it. It's just plain tobacco. There's no flavor to it.
It's still underage, right? Any discussion or thoughts on this?
Underage definitely concerns me. I really think that...
It concerns me too, 100%.
I think that
him, every employee who works underage, we are strictly, because I have a daughter, she's 14. I have a son who is 7, and I understand the responsibility of being father, and of being a father of a growing adult, that how important it is to keep our kids away from this nicotine. And I'm 100% agree with the state and the city, and follow the law, and that's why we make sure for past 3 years we never got a ticket. We made sure that every rules and regulation has been followed continuously, and kept it as per the laws and standards of the city.
I'm troubled by the fact that they can't identify who the employees were. I mean, I can understand maybe a shift change and all that stuff, but you should have been able to...
Is there a camera in the store? Do you have...
Not yet, but we installed after that. We did install first. Once we got the violation, first thing we did, we installed the camera to see what's going on.
Yeah.
Seems as if it was probably not this gentleman, but someone else there that probably
No,
did it.
it was him because it was in his schedule.
But there's still, the store is still responsible
Of
for it,
course,
So I don't see how we can negate the ticket.
All right. Well, do we have a motion to allow the things to stand? There was was more than one infringement. You hate to do it. It's painful. If the fine were less, I think we wouldn't feel bad about it. But it's one of those things where it's very strict, and we shouldn't have to have law enforcement coming in to check on these things all the time. And I think making those 2 installments, having cameras in there,
100%.
It's not a big investment, and it's and I don't think there's much we can do about the.
And as I said, cameras we install, and the machine that you're telling it,
The first thing we're going to do within a week and a half, we can install it, we can provide you the evidence of installing in the store. We can do that, but as I said, the first ticket, I don't agree, and we don't agree because we have no proof of records that was purchased from our store. Second, the gentleman came himself, and he found the inventory lying in my back room, not even selling it, lying in a back room. That's a second infringement. Not selling to anybody, not moving it from my store, it is just lying as an inventory. That was my second ticket I got for, not for selling it. It was just for keeping it in the store, which was, obviously, we can't sell it, so we have to keep it in the store. But we'll remove it. As, after he said, we removed it, but he said don't remove until he comes and check it because he signed it. So once he says okay, we remove it from the store, we discard it. It's okay, it's a cost, but we'll discard it now. We can't afford to have tickets. But I think so. The first ticket, I don't agree, as I said, because there's no proof of record that was done from our store.
Can we consider, go ahead, Susan.
When you fill out your application initially for your tobacco permit with the health department, you do sign that underage sales are prohibited.
Yes.
So you are obviously well aware of that, and it's your responsibility.
Yes. I agree to it, and that's what I'm saying. Since I agree with it, and we have signed it, and I tell my employees to please check ID. So that's why I don't agree that this ticket was given to us, because I know they check IDs every time. This is the first thing in training we tell them to do. Please check ID, don't sell to minors. Please check ID, don't sell to minors.
All right, I think we all have a better understanding, but...
Is there an, excuse me, doctor, is there an appeal process above us?
Theoretically, if the board does vote to uphold the ticket, there are further actions that we can take, but they do vary area by area just because everyone has a different process. Typically, we just suggest that you reach out to your superior court.
It's unfortunate. I think they're trying to do the right thing. They seem well-spoken and honorable, but I think we have to honor the ticket. It's the rules, rule.
Yeah. All right. Shall we make a motion then to uphold the ticket? All those in favor?
Aye.
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 All right, the motion passed. And then it would be nice if you let us know you got the equipment. But I think the scanner also is very good.
Yeah, I'll provide you the proof of installation in my store with the bill and receipt, with the pictures will be dropped to your office.
Well, I don't think, they should do it, but I don't think that changes this at all.
No, it doesn't.
Yeah.
No, I mean,
It's a good thing to do.
It's nice, but
Yeah.
it's
Yeah,
nice,
for
but it
your own
really isn't gonna
safety.
change.
We don't need the receipt. I think it's good for you to do it, but
Yes,
you don't have to.
I think it would be
prove it to
helpful
us.
to hold on to
Yeah.
that receipt, and what have you, so that you can prove it,
Definitely,
should something else come down the road,
Definitely, Mr. Mullen.
but as far as this action is concerned, I don't think there's too much we can do about it.
And I'd also encourage your staff, anything that gets sold gets logged in or a receipt. Even if the people
That's why
say,
we have
I don't
receipt
want
for
the receipt,
everything.
and they leave it there, that's not
We
your
have-
problem. Yeah.
We have a receipt for if it was made purchase, why the receipt was not asked.
Yeah.
I don't agree this purchase was made from our store. I strictly don't agree.
Are you able to obtain the records from that day? There will be
I sell 10,000 pieces a day so of small items. I can give you a record of 10,000 pieces, you can take a look. And I would have sold to a lot of 21-plus customers.
I'm just saying, that is if you are having a record of it for sale,
Yes.
there will be a record of that sale.
Yeah, but how would you know that that sale was particularly made to that girl? Please tell me that. How would you specifically tell me that sale was made to that particular girl? How can you prove that? Because the sale was not made to that girl.
All right.
I agree, sir.
Well, I think we have a motion that's passed.
Yeah.
And we certainly wish you well, and in a very friendly way, we hope we don't see you back again. These regulations are tough. They're made for a reason, and there's not much we can do. But thank you very much, and thank you for coming in, Mr. Griffin.
So what is the...
You'll need to pay the ticket.
So we get to both the violations, first and the second? The second violation is just the stuff was lying there, and you give a ticket for that. It's a 7-day suspension. I have to close my store. I have to let all these people fire for 7 days. I have to let them all go. You have to think of this too. I don't mind paying $2,000 and 7-day suspension. My 7-day suspension is to lock my store up. It's a $26,000 rent in that particular spot, and 4 employees.
I'm getting confused.
And you want me to install machines and everything.
We just asking for him to
Initially, we're
vacate the
discussing the
$1,000.
one,
It's only thing talking about one violation. We're not talking about 2, is that correct?
Correct.
Okay.
Only one
One
violation.
Only
violation.
one, so there's no second offense that we're talking about
Yeah,
here.
just
So
one
there's a ticket of a
violation.
second offense, which states if the one
that came-
flavors he found, he already gave me, which I paid $1,000 for. He wants me to close the store for 7 days and pay extra $2,000.
Mr. Griffith, could you explain to us what he's talking about here, because I'm confused.
If you don't mind me referring to my phone, I just want to.
Yeah,
No, no,
please.
by all means.
I can provide you papers if you want.
So, I actually have the file pulled up on my phone. So, the original violation for the sale to a minor came on June 25th of this year. On September 2nd of this year, I performed a additional inspection based off of the previous comment with the flavored products, because we'd received another complaint that there was flavored products being sold from the store. Thank you. These are pictures of some of them. I apologize that they are, kind of blown up or not individual. That's okay. Well, there's more than 150 flavored products that were, in fact, sealed in the boxes.
Exactly.
There was, however, another white box that previously contained a piece of glassware that had individual vape products that were all flavored. I have a picture of that on my phone if you would like to see it.
Sure.
Again, the fine was written as of June 1st of last year, or actually November of 2019, which we were all notified that they could no longer have the flavored products on premises as of June. Going further into that, any location that I've come across, whether the state has come across that has had flavored products, has received a fine, and we have sealed the packages that where both my signature and the clerk for at the time both sign on it, so we can say, everything that's flavored is here. This is not to happen again. And, in the event that I come back, I know that these are the flavored products. Or if the Department of Revenue comes in, because they also get involved in these matters. The boxes were sealed up, and they received a fine for possession of flavored products. It was not for sale, it was for possession of flavored products.
So is it illegal just for the possession?
Just for the possession as a store owner.
So is that
And-
the second fine then, or not?
That is a second fine. So they also received a fine of $2,000 and what would be a 7 or more day suspension based on, the findings of the board.
Okay, so effectively then, you people are appealing both tickets, is that correct?
No, sir. Effectively, we were appealing first ticket because we don't agree to that. Second ticket, we already paid the $5,000, thinking that second ticket, because yes, it's our mistake. State told us a year ago, remove the flavor, but we did not. We kept it in our back room. And I agree with that mistake. And we agree that, the flavor's lying there, sealed, not selling. We were not selling it. And I accept the mistake. That is our mistake. We left it, that we should have removed it, thrown it, whatsoever. But the
We got
first,
that part.
yeah,
So that's already been paid. So the question is, then,
first one.
is if we uphold the first one, the one that we're talking about here today, does that automatically mean that he has to have the $2,000 fine and the suspension for 7 days?
So because just the way the timing worked, this hearing happened after the second violation. So they had already filed to appeal the first when the second violation occurred.
Okay.
So they had already received, obviously, the $1,000 fine from the May violation, and then the September violation, they received a $2,000 fine. Just because I'm not in.
Yes, yes.
I don't know if they received, if they paid $2,000 on the first fine, or if they paid it as.
No, considering that second fine was our first fine because we appealed for the first fine, thinking, it was wrong to us. So considering the second fine was our mistake, so we prepaid it, thinking it's our mistake. We should pay it because we should not keep the flavor. And when state said should not keep it, you should not keep it. And it's a mistake to find it, and we should pay for that. And we paid for that because we kept the flavors in back room. And we accept that mistake. We are not denying the mistake that we did not. We did it. We kept it in the back. It was there, sealed, not selling. Sealed, kept it. And gentleman found it. And I'm not denying that it was not there, but it was not selling. But the first ticket, as I said, I'm requesting, it is one I'm requesting that we did not do it. And we sincerely, request you guys to look into it, because if you approve the first ticket, the second ticket goes to $2,000 and a suspension. If you don't approve the first ticket, the second ticket becomes the first ticket, which I already paid for.
And am I correct, you would not have gone in there looking for this product if you had not had that first one? Is that correct?
We do, well, Yes and no. We do periodic inspections.
Right, but in this particular case,
In this particular case, we were sent back out there because we had received an additional complaint that there was flavored products.
It wasn't because they were already there once, it's because they got a complaint.
so there were two complaints, is that what you're saying?
Yes, there was a complaint back in May, or no, not in May, I apologize, back in, at the time of the first offense in June.
Yeah.
And then there was a separate complaint that came in the end of August that prompted my inspection in September.
Okay, so both inspections were based on separate complaints?
Yes.
Okay, now we're talking a different ballgame, yeah. I think we still have to uphold the first one.
But I mean, all that was on the agenda and that we have paperwork for today is this first complaint.
Right.
We don't have any other information on the subsequent things, so.
They're
I
not,
think-
they're not.
He's not appealing that one,
They're not
so,
appealing it.
yeah.
I mean, it's simply a matter of fact that, you know, we have to either decide, we can only decide on that first complaint.
But we already did.
However, the chips fall on the second one
Right,
is
we
not
already-
our purview at this point in time.
Becomes just a harsher penalty
Yeah.
for him, but it doesn't
It is,
change.
yes, I agree, but that's not,
Yeah, right.
I mean, it's pretty clear now. It was, before it was a little confusing to me. I think maybe you people felt the same way too.
So does the motion stand?
As I promised, we'll be taking care of, because if suspension happens, a lot of loss for us. But as I promised, if we, going forward from today, we'll be very strict, and we have been, as I said, we installed the cameras, we're gonna install the machine of ID checking. We have hired 2 more new employees to help them out to check IDs.
Well, we understand, but.
Can I make a request that we get a full packet with the timeline? Is that something that can be put together for the next meeting?
You wanna put it on?
I mean, we've already voted and made a motion on
Yeah.
upholding what we had in front of us, but then additional information came in after we made that vote.
But he's not disputing
No, he's not disputing the
what
second
we
one.
were told. He's not disputing that part, he's only disputing the.
Right, so by us upholding this initial $1,000
Yeah,
fine, we'll
right.
kick in his license suspension and shut his business down.
Yeah,
It's unfortunate,
Yeah.
but the bottom line is that both events were brought about by complaints.
So is that fair to say? After tonight, we've upheld this initial $1,000 fine. It now goes back to the state, we'll shut him down for a week?
He would actually need an additional permit hearing before you to determine what the length.
Okay. Well, that's good. Okay.
So if you would like, I can be at the next meeting for that permit hearing, and I can present any additional information that basically is from that second offense.
With the second offense, I accept. I'm not even denying to the second offense. The second offense, because I have a flavor, as I said, it was banned, the flavors were banned last year, and there's a part of inventory which cost me money. So I left in the back, unopened. How can I sell an unopened pack, sir? It's an
The law
unopened
is you
pack.
just can't even have it at all.
I understand, sir, but the first one is request that, saying that I sold a product which is sold everywhere in Massachusetts without a proof of purchase, how, this kills me.
Mr.
Because
Griffin,
I know my
what is-
employees do their job every day.
What is the legal procedure for him to get rid of this product that is no longer illegal for him to have?
It was technically supposed to be either returned to the distributor or thrown out.
Or discarded away,
prior
yeah.
to-
So for him to hold on to it was a clear violation, am I correct?
Yes.
Okay,
There's
so,
bad food in a restaurant, expired contact lenses in my office, you gotta get rid of them,
right, even though it cost you money.
even though it costs you money, right?
Yeah.
Yeah, some companies will give you credit, some won't,
Yeah.
so.
To my knowledge,
Yeah.
it
Yeah.
varies
No, I
to the
accept.
distributor.
So I'm accepting his second mistake, and no denial on it. My second offense was a mistake, keeping it in store. I 100% agreed in front of everybody that it was my mistake as a company, as an organization. I was wrong to keep it there, whereas I should have thrown it away. But second is, we are not here for the second discussion, we're here for the first discussion, which I think was not my mistake. We did not do it, because as I say, we train our team rigorously to take IDs, check IDs every time. And if you pass this if you pass this motion on the first ticket without any proof, that withholds me for the second suspension, because I agree with the suspension. I'm accepting that there was a flavor. I was not selling it in the second suspension. It was just having the flavor in the back room. That's a suspension for. That brings me another $2,000 and another 7 days fine of suspension, sir. If you disapprove the first one, the second offense becomes first one, and I have paid $1,000 for that. And as I said, promised, we'll be taking care of it very rigorously and more efficiently.
What if we allowed him to spend that $1,000 to buy his equipment.
I don't think we have the authority to do that. I don't think
we
the
can do
fine
that.
has to come to the city, right?
Yeah.
Yeah, I don't think we have the authority to do that.
All right, we're gonna just bring this to a conclusion. I think we just have to, we just have to keep it the way it is.
So you will pass, you will give me a fine without proof of purchase? You will just tell you fine because he said so with his words, and we have no value sitting in a Waltham city serving for 3 years?
You have the right to appeal.
If he can prove me proof of purchase, I'll take a 7-day suspension.
There's a right to appeal.
Yes, sir, I'll take a suspension for 7 days
We
if he can prove of
hold the
purchase, please.
Payment of the fine until he appeals.
I don't know how that's.
This is the appeal.
This is the appeal, this was his appeal, so there's no place else for him to go, is that correct? Correct. Okay, so this is it.
There are 7 smoke shops, sir. There are 1 next door to me and 1 next door to me. There are 3 in one line, in a difference of 2 shops. You cannot say that he cannot come to, he would have gone to any shop, 3 shops in a line, in 1 line.
You
One
know.
shop, smoke shop, second smoke shop, third smoke shop.
We understand. The law was broken. We're gonna close this and.
I'm just trying to defend myself. Thank you.
All right, thank you very much. We're gonna uphold offense. Okay? Yeah, thank you very much.
Thank you. Fine was upheld, yeah.
So there's no proof of purchase providing to us, that they bought from us?
Right.
Well, you can appeal to the state, right? The state, he does.
No,
he
I
did
appeal to
say-
you, sir. You have to tell them to appeal to state.
Well, what's brought before us were 2 infringements, and right now,
But you should look to your
the
city
first
people.
one that's there, and we've been through this problem before in the past, and we've had a policy, and that unfortunately, it's gotten so strict now, it's into these fines that are beyond our control.
So I'm not denying the fine. You got to understand, sir, I'm asking a proof of purchase of first purchase. How can you put on me that he cannot provide a proof of purchase that was purchased from my shop? How can you blame it on us?
What is your answer to that?
Please provide me proof of purchase, I'm accepting the
These
fine, both
papers,
fines.
Yeah, he has people that came from, I don't think this.
That is not a proof of purchase, sir.
I don't
would
think
not
we
accept
can
that as proof of
accuse the
purchase.
state
It
of-
has to be a copy of receipt
Yeah.
that we provide to every consumer, if they ask. Did she ask for one? Did she ask for one, sir?
Not in the store, so I cannot say.
There you go, sir. If you were not in store, how do you know that she was in my store?
Because I watched her enter.
It's okay, I'm not going to argue to that, so I'll leave it to him, Dr. Handy, to you, Mr. Mullen, ma'am, sir, and you as well, Mr. Henley. It's all upon your decision to taking a right decision on something which is there is no proof of.
All right,
You cannot prove a guilty until it's proved guilty. I'm still innocent, I'm proved, this is not proving guilty, sir. You're proving in a person, innocent person guilty without giving a proof of record.
I think most cases are similar to this, right?
No, sir, if you come to Boston, you go to Cambridge, we have stores, they provide you proof of purchase.
Did
They do it.
anybody ask for proof in other situations?
I've been asked for proof previously.
And they have provided it.
As I mentioned previously, that I can attempt to obtain a batch number and contact the distributor and see where it went to. That is the best way that we can do it. In the past, if it happened with a pack of cigarettes, just because there is more, cigarettes have obviously been around a lot longer than vapes have. Cigarettes have a sticker at the bottom that have the stamper ID with all of their information that you can actually track down store by store to see where it was sold.
Why don't we hold
You wanna-
on the
you wanna table
enforcement?
this?
We'll table that pending the outcome of your investigation. If in
Thank you,
fact
Mr. Mullen.
you make the determination that it was gone to their store, then it's a moot point. The appeal of the ticket stands. How does that sound?
That sounds good. So Bernie has a motion to table until next meeting. The
Override the
enforcement,
previous motion.
until we can find a little further
However,
proof.
the addendum to that, though, is if it is determined by Mr. Griffith's
Then we
investigation. Then we uphold. It's already the moot point, so we don't even have to bring it up again. If-
Yeah.
If he's if he
Yeah,
notifies the
if you
board.
notify us with the proof, then that's it.
I can just say one thing. I do not know if that same technology exists when it comes to vapes. All I can say is that I had my minor come to Waltham for one inspection. We went into one store because we received one complaint regarding Blue Moon. I watched the minor walk into the store with nothing but the cash that I had given her because I held onto her ID and her wallet, which is how I know she wasn't ID'd. At which point she returned back with the flavored, or not the non-flavored product, but the vape product, and I drove immediately to Government Center. So There was no other stores visited. It was literally the one inspection due to the tenant. If the technology exists to where I can get a batch number or something off of it, I certainly will, but I can't guarantee that, just because I do not know what technology exists regarding electronic nicotine systems.
What it boils down to then is, unless they prove otherwise, he's got enough information for us.
You know,
I
it
mean, we
looks like.
kind of already
it
had the
looks like
motion
there's
voted on it, didn't we?
Yeah.
Enough, if you can even look into that, and we can always vote to rescind, but I think we just have to, we've already voted on this.
Yeah.
So we'll leave it at that.
Yeah.
It's being upheld, okay?
And we certainly appreciate your efforts, Mr. Griffith, on that, and also.
His
to
word
go
against
back-
us?
It's not a word against word. He's given what proof that the state
There is no
usually
proof, sir.
gives.
Prove
He's
me a
gonna look into
purchaser.
it. We're gonna draw this to a close. We were almost finished. We have other things to finish the
Dr.
meeting.
Hanley, you would understand, sir. He is not providing a proof of purchase. He gave me a second ticket of keeping something that I was not selling. You want me to,
That doesn't matter, because whether it was sold or not, it wasn't
it is not
supposed to
sold,
be in
sir.
the
There is no
in the
proof that
store.
it is sold. How can you tell it is sold? Just because his word? It is not
Doesn't-
accepted,
That's
sir.
not what the infringement is. It's possession, right?
That's a second violation,
second
sir.
one.
Possession is a second violation.
First is
a
the
sold,
selling to
which
the
I
young
don't
lady
agree.
who went in, yeah.
It did not
That's
sell
what
it.
we're upholding.
All right.
We ID people every time they enter. I do not accept that he's saying that somebody came. I don't accept that, sir. I don't believe that somebody came under 21 and we sold. Why in 3 years there was nobody came and
All
we
right,
sold
we'd love to
21?
give you the benefit of the doubt. We've looked at all the evidence, and we voted on it, and I think we're gonna have to just leave it at that. And we really wish you well.
How you
We're
wish
not
me
trying
well
to
with
hurt
7
you.
days
We're not
suspension
trying-
and firing
We
for
didn't
employees.
break the law, you know.
No, I understand, sir. You did not write the law, Dr. Henry.
And this is unfortunately.
But this is
one
not
of
the law. How can you prove somebody guilty without proving it proof? Please tell me that. How?
We're gonna argue in circles.
No, sir, I'm not trying to argue, Dr. Henry.
and
I'm
we've
just trying to
already
say
made a
just,
decision.
because this second ticket, second violation is gonna give me a long loss, sir. It's a long loss with this COVID going on, and me close for 9 months when the COVID was not there, sir. Nobody came to help us. 9 months we paid rent to that gentleman. State was not there to help me. State didn't give me PP loan because I'm a smoke shop. They don't approve my PPL loan because I'm a smoke shop. They don't give me a single fund for 9 months. I know how I gave them pay. I know how I paid rent in that store for 9 months in COVID, sir, when you guys were closed in Waltham. None of you guys came to help me out. And now you tell me that without any proof, you give me a ticket of $1,000? This makes no sense, sir.
Yeah.
Tell me, please,
All
did
right,
state come and help me
we're
with the
just gonna
PPL
close
loan?
this off
I
at
think
this point.
you should get a lawyer and take it to court.
Yeah, you can?
This isn't a court of law.
Yeah.
But,
you
sir, this
can.
is your
Don't-
decision, sir, Mr. William.
I
Dr.
understand.
Hanley, this is your decision to decide whether I should get a first ticket or not. Without a proof, you should decide whether
Well,
somebody
the
who's
evidence
trying
is
to serve the
there
community.
until proven otherwise. What can we say? We have the law enforcement here. He's brought the evidence here. There's nothing else we
That is
can
not
do.
evidence, sir. That is just a picture of a product that could be brought anywhere
No,
in
if you're
Massachusetts.
if you're saying that the state is fraudulent in doing this, then you get a lawyer, and you know, you have your perfect rights to go after that. But from the way it stands right now, we can't challenge the state on this. You can. You can, but we
I
can't.
challenge, sir. So he has to get me proof of purchase before you accept it.
All right, we're
Before you
gonna
give me a
move on to
violation,
that.
accept the withhold the permission, you know. He should prove, and then I can accept it. If state proves me that I'm wrong, I accept it.
If I bring the product here, you're just gonna claim that it could have been sold anyway.
Exactly, sir. The store. So do you know that product is sold in 690 stores in Massachusetts? There you go. So you don't have a proof for that, sir. My only concern is that.
Thank you.
Okay?
All right. Reliable bodywork.
Thank you, everybody. I'm English no good, so I need my friend help me. I'm speaking Chinese English. Thank you.
She wants to thank the board for issuing a temporary license for bodywork at her establishment for the last 2 weeks. And she's here to present herself to get the final approval so she can conduct business. The temporary one expires tomorrow.
Can you explain your training?
No, I'm just a family friend.
No,
Just-
her training for
No.
doing the
A
body.
long-time family friend.
No, I'm just helping her with her English because there's no interpreter for her.
All right, go ahead. Does she want to speak?
Speaking slowly is okay, but you want friend helped me, but I'm speaking Chinese English. Maybe you don't understand.
So far, we're good. We understand.
Good, we're okay.
I'm very nervous.
Don't worry.
Well, the first time before a board, that's why.
Yeah.
Can you explain to us what your background is? You're opening a new establishment?
Yeah,
Yeah.
opening a new establishment.
Yes.
And what's the address on that?
139 Moody Street, Watson.
139 Moody, is that correct?
Yes.
Okay.
And what is it that you actually do? Are you a physical therapist, or what is your training?
I prefer just come to massage therapy business lessons, but I wait a long time, so I just opened. So.
Yeah, but to answer the question more directly, she's been a massage therapist and a bodywork therapist for 7 years, right?
Yes, I have 7 years massage therapy license and a bodywork license.
And where did she practice that?
On the application shows she owned a business in Arlington.
In Arlington?
Yes.
Yeah, she's licensed by the state. There's a copy in here, Dr. Moore.
Also provided us a diploma and a transcript of her education.
And yeah.
Excuse me, Mr. Chair. Sorry. I can probably help out a little bit in what's going on. She's come into us probably at the end of or mid-August, looking to become a Bodyworks establishment and a Bodyworks practitioner. She's been going through the state, however, the state is so backlogged, she wanted to get a massage license for her establishment at 139 Moody Street. She'll probably still get that establishment license, but she wants to move a little quicker, so she's been losing pay and hasn't been able to take care of herself and her family for a short time due to the fact that the state has been so backlogged. So she said, you know what, I'd like to do Bodyworks in my place, which is fine, she has that right to do that. So what ended up happening is I had a conversation with the state. They explained to me that yes, she will be getting her license within due time. They have no problem with her, you know, if she wanted to change things and take the avenue of going to Bodywork. So I did in fact issue her so she could start her business and start to make some type of an income. We did a query on her and a SORI that came out clean. There's no background on her. So where she did that, and she's been coming in faithfully, and her friend has been coming in faithfully as well and speaking with me periodically. So I did issue a temporary license for both pieces, for the establishment and the practitioner part, to get her through to this board meeting tonight so she could start to build her business and make her living. She did come from another city, Arlington or Lexington.
Yeah.
So she is moving into Waltham and wants to make her business here in Waltham, and she's made it quite clear she wants to make it a reputable business.
Thank you.
And the facility was
she
inspected?
I'm sorry, 2 questions at once. I'm sorry.
Go ahead, Dr. Morello.
Go ahead.
Is the facility was inspected?
The facility, Tommy has visited
Yep.
several times. We
Okay.
will go back out again.
Okay.
If this gets approved, we will go back out again.
So this is just continuing on what she was doing in another.
Yeah.
Do we have a motion to approve?
Yes, so moved.
So we can extend her temporary license?
I can issue her, if you approve it, I can issue her a year permit. It would expire at the end of next year, or I could do every 6 months, however you want to do it.
I mean, I don't see any reason not to give her the year, and then, you know, if she gets her massage from the state, then she's got both, right?
So a motion to accept approval for a year?
Regular permit, yeah.
That's for both, the
Yeah,
personal
I'll give
license
her a
and
couple
also
minutes.
for the
Facility, yeah.
establishment, right?
Yeah.
Always got to just make the offer.
All right. And,
Thank you, everybody.
You're welcome.
You're welcome.
Good luck.
So Michelle, how do we get the?
I have to issue you a new permit, so you just have to give me a little bit of time, because I'm sure you heard that I'm a little bit behind with everything. I don't have clerical staff, so I'm pretty much doing everything with one of my other inspectors. So I will get it to you, and I will have one of the inspectors drop it off to you.
Okay. because
Okay?
It expires tomorrow.
Yeah,
Yeah,
just keep
that's
operating
okay.
with that.
That's okay. You can operate with that because we know.
Oh,
Okay, thank you.
We know.
Thank you, everybody. Thank you for
Thank
your
you.
time.
Good luck.
Thank you.
All right, next on the agenda is Happy Feet. Happy Feet?
Mr. Chairman, I'm going to let Tommy go through this with you with one of the inspectors.
We got a complaint from the police, and being the permitting authority, I sent Mike up. When he did his inspection, he found an unlicensed person there. So that's why we're here. So he can probably speak better to it than me. I just went up at the end and did an inspection with him.
Yeah, we did an inspection of the premises, and we did find one of the employees was not licensed at the moment. The excuse given was that the person had just come into the country maybe a month or two earlier, I forget. And all other staff was licensed. They did have quite a few licenses, actually. And I did find that everything that they were telling me was truthful, and they haven't had any issues. They've been open, I think, for 5 years, I believe since 2016, and this is their first issue that we've had with them.
Hygienically, everything is up to date.
Very good, yeah. Yeah.
Is that person still there, or is that person licensed now?
I don't believe that person is there any longer.
He's gone.
Not there, okay.
So they need to be licensed before they...
Yes. I think...
If my memory serves me correctly, Happy Feet was one of the first establishments that we licensed way back when. And the owners were very good at the time in terms of going through the process of getting the establishment licensed, as well as all of the individual operators of it. I'm not sure the exact term that we're supposed to use for these people, but we'll say the operators. And I do remember that there were some issues along the way there, because a lot of them had come from China, and there was getting the, understanding the requirements over there and their documentation. So I find it a little difficult to understand why, with that great background on the part of the owners, they would hire somebody now without going through the process which they had done before. So I would like an answer to that question.
Do you want me to?
Why? No. Yeah.
Thank you. My name is Jun Lu. I'm the co-owner of Happy Feet. My wife is the other co-owner, but she has to stay in the store because there's so many things.
Right.
So first, I want to say we're truly sorry having a therapist working without a license in our store. There's no excuse on our side. We know it is a very serious violation. We really hope that you give us a chance to correct our mistake, and we promise it will not happen again. Overwhelming comments in Yelp are very positive about their experience in our store, and our store is very popular, and we will be received among the countless customers for the last 11 years. So the store has been 11 years. So looking back, it's the chain events resulting in our forgiven mistake. As most of our licensed therapists left around last March after COVID-19 started, we had closed the store for 3 months. Since then, we have been under enormous pressure to retain, find a therapist, and keep the store open and pay the rent and other expenses. For a long time, we only managed to have 3 licensed therapists. Until 3 months ago, we hired this unlicensed worker. He worked for us in our Watertown store in 2019, where it doesn't require a license. And importantly, he had no complaints. So we trust him. And due to the desperation to maintain and the business floating, we made a bad decision by having him working here while applying for his license. However, one thing slowed down the application. We couldn't get his high school diploma. So this gentleman is old. He graduated from high school in 1980s. And he said he has a copy in China, but we still couldn't get it. So without a high school diploma, we just couldn't apply. So, but that's still, we shouldn't hire him. Only into the third week working, he has been accused for unwanted touch during the body work session. Although we believe him and strongly defend him talking to police, we have to wait until let court decide whether he's innocent or not. Regardless of the final outcome, we let him go. No matter what, we will try our best to assist him on his court preparation and appearance. We always have concern how to prevent unwanted behavior in bodywork session, particularly on female customers. The current events force us to come up with two solutions. One is to have female therapists working on female customer. Two is only use a therapist with multiple year experience and zero complaints. We welcome any recommendation from board member on this matter. So the current 3 licensed therapists and 1 coming, so I already applied the renew. He worked with us before. I worked with us for several years with zero complaint. Through this ordeal, we learned a hard lesson, aim eliminate any possible complaints and violations. We would like to continue provide good service to local residents and be a valuable member of a Moody Street community for the next 10 years and beyond. Thank you for your time. And again, we are truly sorry for what happened and hope you give us a chance to correct our mistake. Thank you.
You know, it might be helpful if you ask the customer, do you have a preference to a male or female therapist?
So this is really
interesting. And then
interesting.
you already get a sense of what their response is, and it's helpful to get the direction.
So if you, our store, we actually try not hire a female therapist because we're afraid, because in the room we couldn't control. And there's in the past, and there's a lot of complaint, not in our store, but it's happening between the male customer and the female therapist. And as a result, we only have one old female therapist. But there's a lot of women, female customers, want body work. And I always concerned because we couldn't put a video camera there. And this guy, after that, I talked to him, he said he didn't do it. And that's why I talked to police. I said, I don't believe it. And police said, he believed the female customer, and that's what happened. So now this is what my solution is the try use the female therapist, the older one, and also the one with a lot of experience and not complain. And maybe in the future we only have a position like a face down, so there's nothing. You don't touch the front body, only back. But still, this is a. I never figured out 100% how to prove how we can prevent that.
But that's not the issue we're dealing with. We're dealing with the unlicensed person.
Yeah. So he's gone. So this will never happen again because what happens, we couldn't pay enough for the rent and operating everything. So we are really in a rush to get him and apply for his application. But then in the third week, this thing happened. But also we couldn't get his high school diploma. He said he's in China. We called his relative. They said they couldn't find because that was 50 years ago. But we're truly sorry. I don't believe this thing will happen again. This is really.
Was a fine issued?
Huh?
Well, I think he said there's criminal proceedings against that, but that's not what we're dealing. We're dealing with the unlicensed person. Yeah.
I didn't know he was going to bring that up.
Yeah.
That's the reason we were brought there, but it's an allegation, so.
Right. That doesn't
we
impact.
went there,
Right.
to do an inspection.
I want to see everything.
Sure.
Okay.
So-
Thank you for being up
Yeah,
front.
so
with it.
that's how
Yeah.
Mike found the unlicensed masseuse or whatever they call them. But we're not here for the alleged.
Right. So we're just dealing with the unlicensed person who is now gone, so that's
Yeah.
step one, that's good. Reason he's gone is different, but he's still gone.
Yeah.
So now do we want to find him?
Yeah, I'll
penalize
give you the
him?
background because that way you know why
Right.
this person was
All right.
found.
Well, he has a good track record for many
Right.
years.
Mhm.
He has a clean establishment. He's aware of and sensitive to the problems. And you seem very forthright and honest in coming forward and explaining yourself. So would anybody want to put a motion to?
The question is, do we warn them or do we fine them?
I think just he understands a warning.
Warning is fine.
And,
I'm okay with that.
All right.
is that all right?
Warning is okay
A
by me.
warning.
Yeah.
So a motion for
Sure.
a initial warning.
Yep.
Second.
Oh,
And
thank
that's
you very
all.
much.
And
We'll fix that.
we have faith in you.
And if it happens again, there will be a fine, but it won't happen
It
again.
won't happen again.
Okay.
This is, we will never have any unlicensed person. This is, yeah.
Okay.
Excellent.
Thank you.
Thank you.
All right. And lastly, update on Garden Crest? Mike?
Went overtime today.
This is actually
Good evening,
shorter.
everybody. How you doing?
Good, how are you?
Just a few quick updates on Garden Crest. This is an update as of today. Since August, they've replaced all the dumpsters on the complex. They actually went from 8-yard dumpsters to 10-yard dumpsters. All the dumpsters have lids. They are better practicing closing them more on a regular basis. There's still occasionally, I have gone by there, and there's occasionally the lids are open, but for the most part, I've been inspecting over there weekly and have not seen a wholesale overflowing of the dumpsters like we used to see over there before. Pest control has been increased over there. In fact, I got a pest control report today. It's also very descriptive. It points out that they have bait boxes, they inspect around the dumpsters, check around the buildings. So I do notice more bait boxes around the buildings. New signage, that was another thing that they had to do. They put signage, put stencils on the ground that tells you not to put any trash on the ground. It has to go in the dumpster no matter what, because that was another issue that was ongoing. So now I see more trash going in the dumpster rather than just being laid on the ground. Again, all dumpster lids are mostly closed all the time. They all have lids on them. They do monitor them on a regular basis. Still conducting weekly inspections. Areas surrounding the dumpsters, again, cleaner, so I have noticed that. Maintenance does monitor the dumpsters every morning. They go around and take a look at it. And finally, another thing that they have done recently, they did hire a new landscaping company, and I am noticing an improvement on the grounds itself. There's no more piles of brush around, which can attract rats. Leaves are being picked up when the minute falls down. There's an area in the back where they dump all the old couches. That gets cleaned up more on a frequent basis. So there is improvements going on over there. If you have any questions, I'll be free, glad to answer it.
Were any fines paid?
Fines right now it's been filed in court and still in litigation. So as the law department said, if further along we needed more information on it, that would be something we'd have to discuss in the executive session.
Thank you.
As a matter of how they comply, is it a Texas investment company that owns Garden Crest? They're out of state, I think.
They're from Virginia.
Virginia?
Yes.
So when things like this get approved, it usually in big corporations takes a long time from headquarters or their local people who can actually do the improvements that are required. Who do you deal with there when
I deal with the property manager over there, and because they do have a attorney that's in Braintree, I think that chain they shorten the chain a little bit, so things are getting done a little quicker. So I'm sure it reaches Virginia, but I think the decisions are being made more locally.
I had a patient that who told me, who lives there, and there's some person, an elderly couple that feed the birds and they throw a lot of food out on the ground. Are you familiar with that?
Yes, that's another thing that was done during the court action that we're doing. We did make notes of the bird feeders. There was some bird feeder issues going on. I have seen a reduction in it. There's still a few over there, but there has been a reduction on that. We pointed out a lot of things when the court case initially started. Point out that the people were dumping grease. There was a lot of excessive use of gas grills out in the back where that can attract rats, things of that nature. So a lot of that stuff has been reduced considerably, but there's still some work to be done.
Right. Well, it's all good news.
So they didn't increase the amount of dumpsters, just the size of them all, right?
That's correct. They increased the size of the dumpsters.
That's 25% larger, though. That's pretty good.
Have they abandoned their argument that it was the neighbors that was doing the dumping?
Yeah.
Or are they finally taking ownership?
They will never admit that, but they're, I think, accepting their fate. And another thing, on some of the dumpsters that are real high-priority dumpsters, they've also put additional signage around there. They still claim they're gonna put cameras around there. That wasn't a condition, but it's still something that they're planning to add as part of their discussion.
All right. Any other progress?
I think we should, continue to monitor it, and maybe give them another month or two and see what happens. This is a much better report than what we've had for a while. However, if, say, maybe by the December meeting, we don't have substantial action from the courts, then maybe we need to have the law department come in and update us on that one, because, effectively, they're playing the, legal game of stringing this thing along for a period of time, and, it really is kind of making a mockery of the whole structure of the, the authority of the board with regard to impose fines. So I think we should follow through with that, but let's give them a couple more months to, and then see what happens.
Sounds good. So we'll table it to further discussion, and
You'll say December or whatever,
and that motion is passed, and thank you very much.
Okay, thank you very much.
And
Thank you for your
are
time.
there any further business, new business?
For the December meeting? You want to go into executive session? That's the only way it
You
can
should
be.
ask them to come in. You want to ask them to
Yeah, for the
come in
December
so we
meeting.
can get an update on terms of
You'll have to go in.
Where we
the reason
would stand.
open meeting laws, we have to put down, you're going to go in executive session.
Yeah, let's, you guys good with that?
December.
Yes.
I mean, I think
24th.
maybe it would be useful to see if you'll take it.
December 24th at 7.
December 24th.
December 24th, yeah? Right.
Okay, so then this is just gonna be moved to December, if I'm understanding it. It's
December.
gonna be moved to December and for executive session with law, okay.
Okay.
Now you have to vote on your next meeting.
So, calendar,
If you're looking at November, the first Wednesday is November 3rd.
so that works for me. Anybody?
Fine for me. So no October meeting.
The 3rd, 5 o'clock?
Sounds good.
Say again, Dr.
November
Morrow?
3rd at 5 PM?
We're skipping October?
This was October.
This is October? Oh, all right.
This was October.
November 3rd?
So we have to put the mask mandate on again for that date, for that meeting, right?
Yep.
Yeah, and that time we'll see what's happening with all these foreigners coming in to the cities, if it's gonna ramp things up. Do I hear a motion to, and no new business? Motion to adjourn?
Second.
Second.
Motion passed. Adjourn to November 3rd.
Pleasure.